Hi everybody, and welcome to the newly released Beating Diabetes podcast with Dr. Michele. This year the podcast will be focusing on all things diabetes. And as your host, I'll be recording solo episodes which will cover some of the most common questions I'm asked as a physician, such as, what can I eat as a diabetic? How can I lose the extra weight that I've put on recently? Is it really possible to reverse type 2 diabetes? What can I do to prevent my children from getting diabetes since it runs in the family? And more. I will also be coaching patients and clients live on air and conducting interviews with other diabetic experts. I hope you enjoy the show. On today's episode, I thought I would share a little bit of facts and figures about diabetes, just to clear up some of the confusion out there. So the prevalence of diabetes is spreading like wildfire. I think pretty much everyone knows that, and it's predicted that in the next 20 years that 1 in 3 people will have diabetes, which is pretty scary. Right now, 30 million people in the US have diabetes. That's 9.4% of the population, and it's going up exponentially every year. 23 million have been diagnosed and 7 million are undiagnosed. So there's 7 million people walking around right now with diabetes that don't even know they have it. That's another scary number. Let's hope that none of us listening are in that group, but if we are, there's a lot of things we can do to reverse this before it takes over our lives. In the different age groups, it varies. So in the younger age group from ages 18 up until 44, we have about almost 5 million people with diabetes. Over the age of 45, when we're talking 45 to 64, that's 14 million. And then in our senior population, 65 and older, that's 12 million. It's almost even men and women. Men is about 15.3 million and women is 14.9 million. Another interesting fact is that type 2 diabetes is rising in our children and our adolescents. It used to be called adult onset diabetes. And now that there's so many young people, teenagers and young adults and even kids that have issues with their weight that are developing type 2 diabetes, they don't call it adult onset diabetes anymore. They just call it type 2 diabetes. So there's over 130,000 children and adolescents with type 2 diabetes. And there's 193,000 children and adolescents younger than the age of 20 that have it. So the 132,000 is for under the age of 18, and then under the age of 20, it jumps up to 193,000. So you can see just in that group from 18 to 20, it's a huge number. And also want to note that only about 5% of the people with diabetes have type 1. So when we talk about diabetes, 95% of the people have type 2 diabetes. So usually that's what we're talking about. And when we specify type 1, then that's when you know we're talking about type 1 diabetes. People have asked me before, can you specify that you're talking about type 2 diabetes? And yes, I can. And at the same time, 95% of the people that have diabetes have type 2. So usually when I talk about diabetes, I'm talking about type 2 diabetes. And if I'm going to talk about type 1, I'll specify type 1. Diabetes also varies in race and ethnicities. So there is a higher prevalence of diabetes in Native Americans, in the African American population, and in the Hispanic community. So Native Americans are about 15% of the diabetics, African Americans are about 13%, Hispanics are about 12%, and the remaining 15% is split about 7 to 8% each between Caucasians and Asians. Among the people of Hispanic ethnicity, Mexicans have the highest prevalence with 14%, followed by Puerto Ricans with 12%, Cubans 9%, and South Americans 8%. Among Asians, Asian Indians have the highest percentage, which is 11%, followed by Filipinos with 9%, Chinese 4%, and other Asian groups totaling 8%. The prevalence varies significantly by education level, which is an indicator of socioeconomic status. Specifically, 12.6% of adults with less than a high school education were diagnosed with diabetes versus 9.5% of those with a high school education and 7% of those with more than a high school education. So the more educated you are, the less incidence of diabetes is found. Now let's talk about prediabetes, the prevalence of prediabetes. An estimated 33.9% of U.S. adults aged 18 years or older, which totals 84 million, have prediabetes. And this is based on their fasting glucose or their A1C level. 84 million people with prediabetes. So we already talked about 7 million people are walking around with undiagnosed type 2 diabetes. And now we're talking about 84 million people have prediabetes. So what that comes out to is nearly half of adults aged 65 years or older have prediabetes. 48.3% of seniors have prediabetes. Among adults with prediabetes, 11.6% reported that they were told by a health professional that they had this condition. So out of those 84 million, only 11.6% know that they have it. So the other 92% of the 84 million people don't even know they have prediabetes. For prediabetes, it's pretty similar among the different racial and ethnic groups, and it's a little bit higher in men than women, but not much. Again, it's almost even, a little bit higher in the men. So let's talk about some of the risk factors. A lot of these are known very commonly amongst the general population that these are risk factors, but some of these you might not know about. So I'm going to talk about the most common risk factors. Smoking. 15.9% of adults are current smokers, and 34.5% had quit smoking, but had a history of smoking at least 100 cigarettes in their lifetime. So if you fall into any of those categories, either you're a current smoker, you used to smoke, or you've smoked in the past, but you've quit years ago, but you had a really long history of smoking, this is a risk factor for you. In fact, I've had this conversation with some patients where I've asked them if they were a smoker in the past, and they said yes, and I explained to them, okay, this is a risk factor. And they said, well, I quit smoking 20 years ago, which is awesome, and that's great, and I give them praise, and I tell them that they're doing great work in that area of their life. However, how long did you smoke before you quit? And I've had some patients tell me, because I do work with a lot of seniors, I've had some patients tell me that they've smoked for 40 years, but they quit 20 years ago. And so I have to tell them, well, how many packs of cigarettes did you smoke a day? Were you 1 pack a day, 2 packs a day? So let's just make the numbers really easy. Let's say that they smoked 1 pack a day for 40 years. So in medical terms, that's a 40-pack year history of smoking, which means they smoked 1 pack a day for 40 years. If they smoked 2 packs a day for 40 years, then it would be an 80-pack year history. So making the numbers easy, let's say they smoked 1 pack a day for 40 years, but they quit 20 years ago. That's awesome, but those effects of smoking stay in your body and cause you to have risk factor for a number of things, including diabetes. Okay, second risk factor that we're going to talk about is being overweight and or obese. So the statistics are that 87.5% of adults in the U.S. are overweight or obese, and that's defined as having a BMI, a body mass index, of 25 or higher. So I know that this is, an area of controversy in terms of the statistics and the BMI, because there's a lot of things to look at. There's genetics in terms of your body shape. Are you big boned? Do you have really big, long bones? And are you really lean? Are you not lean? Are you short? Are you tall? All these things factor in. And yes, everything varies and everything's individual. But if we're just looking at the general population and getting a census of where we stand as a community, as a culture, 87.5% of us are considered overweight or obese. And so all we want to say about that right now is that is a significant risk factor for type 2 diabetes. Number 3, physical inactivity. I think you may have heard people talk about sedentary lifestyle, and a sedentary lifestyle is becoming just as deadly as smoking or being overweight, or of having high blood pressure. They've been doing studies on it, and they know that being inactive and having a sedentary lifestyle is a huge risk factor for a lot of different conditions. Again, just like smoking, it's a risk factor for diabetes. So the statistics on this are that 40.8% of adults were physically inactive. These were on last year's statistics. 48.8% of adults were physically inactive, defined as getting less than 10 minutes a week of moderate or vigorous activity in each of the physical categories of work, leisure time, and transportation. So 40% of adults report that they get less than 10 minutes a week of exercise. I mean, you can probably get 10 minutes of exercise just walking, to your car from, different places that you park, and going grocery shopping and doing different things like that. So that pretty much means that they're not doing any activity, because 10 minutes for an entire week is really not anything too significant to speak of. So, when I work with patients and clients in helping them get over some of these hurdles, physical activity is definitely one of the biggest ones that people need help with. And I know I'm going a little off track here, but I just have to say this, that it's not easy to start being active again once you've been inactive for a long time, whether it was from an injury, or you were sick and so you couldn't work out, or you went away on vacation and you got out of your normal routine and it's just hard to get back into the rhythm, or your schedule changed with work and now you're working nights and you're just too tired during the day. I mean, there's so many different reasons why people become inactive compared to being active in the past. And it doesn't really matter right now, what the reasons are, because everybody has a story and everybody's story is important, and everybody has different reasons why they've become inactive if they're in that state. But what we really need to look at is, what are some small changes we could do in your daily routine to get you back to being active? And so when I work with these people, we start with really, really, really small increments. So I can start someone off on, let's just have you do 1 minute of exercise every morning when you get up, whether that's jumping jacks or just stretching or jogging in place. Anyone can, that, doesn't have a physical limitation on their body, can do 1 minute of something like that in their own room. They don't even have to go to the gym or buy anything. You could just jog in place for a minute. And then we'll work up to 2 minutes, and then we'll work up to 5 minutes. And once you even start doing that 1 minute a day for a few days in a row, you actually do start feeling the benefits of it, even that 1 minute. So that's something that is super important. And I just want to stress that it happens to all of us at different points in our lives where we become inactive for different reasons. And it's hard to get back into the groove of getting active and getting that exercise. But we want to strive for a goal of 20 minutes of activity a day. Okay. And it could be any type of activity that gets your blood moving, whether you like to jog or walk or dance. I know a lot of people don't like to exercise, but they love to do a dance party in their room or, in their house. So whatever it is for you that you like to do, just start with 1 minute a day if you've been inactive for a significant amount of time. And we're going to work on getting you up to 2 minutes and then 5 minutes. Okay. So we're going to work on that. I'll have some exercise for you later in another episode. So back to the risk factors for diabetes. Review: smoking was the first one. Second one was being overweight. Third one is physical inactivity. Fourth one is high blood pressure. 74% of adults have a blood pressure of 140 or higher for systolic and 90 or higher for diastolic. So when you get your blood pressure taken, for those of you not in the medical field, and they say, a normal blood pressure is 120 over 80, the number on top should be around that 120 or lower mark, and 74% of adults have it over 140. And the number on the bottom, which is the 80, for a normal number, 74% of adults have that higher than 90. And or they were on prescription medication for high blood pressure. So they either are, these 74% of adults, they're either on a medication for high blood pressure or their blood pressure is higher than 140 over 90. And this one is something that I deal with a lot with my patients, again, especially my seniors, because a lot of them have had high blood pressure for years, and they've been taking medication for years. And after a while, just like with a lot of things, your body can become accustomed to a particular high blood pressure medication, and it can actually stop working. So I've had a lot of patients that are coming in for something regarding their foot. Since in my practice, I'm a foot and ankle doctor. They'll come in for one thing, and we take their vital signs, and we'll see their blood pressure is like 150 over 95. And I'll look at their chart, and it says all their medications, and they're taking, 2 different blood pressure medications. And so I'll ask them, how long have you been taking this? And they'll say, 5 years or something. And I'll let them know, okay, we need to get you on a new medication because it's not working anymore. And if they come in for a series of visits, and I've seen them for several different dates, and I can look at all their different blood pressures and that we've taken, and all of them are high, again, I'll remind them, we need to talk to your primary care doctor. Let's get on the phone with them right now together and let your doctor know that your blood pressure medication isn't working and we need to switch you to something else. So if you're taking high blood pressure medication and you notice that your blood pressure is still high, that doesn't mean that you're doing something wrong. I know a lot of patients feel like as soon as I start asking them questions about that I'm implying that they're eating too much salt, or they're eating a bad diet, or they're not doing certain things that their doctor has asked them to do. And a lot of times it has nothing to do with that. It could just mean that your blood pressure medication isn't working anymore. So check with your doctor if you're taking it every day and your blood pressure is still high, especially if you've been on it for a long time. Okay, the next risk factor, number 5, is high cholesterol. 58% of adults aged 21 years or older with no self-reported cardiovascular disease were on a cholesterol medication. 67% of adults aged 21 years or older with self-reported cardiovascular disease were on a cholesterol medication. So what that means is if you already know you have heart disease, 67% of you are taking a cholesterol medication. If you don't know that you have heart disease, 58% of you are taking a high cholesterol medication. So if we just round that off, that's about 60 to 65% of adults are taking a high cholesterol medication. That is a huge number. Some cholesterol numbers are high because of genetics. There is a component. I know a lot of people that have that, but most of it is related to diet. So we're going to talk about that later. Just want to list it here as a significant risk factor for diabetes. Number 6, high blood pressure. Sorry, I already said high blood pressure. Number 6, high blood glucose. 15.6% of adults had an A1C value higher than 9%. So This is for people who have not been diagnosed yet, and they come into their doctor, and their doctor suspects that they might have diabetes, and they run an A1C value on their blood test. 15.6% of them are coming up with a number higher than 9%. So that is a significant risk factor here for complications of diabetes. Okay, now let's get into the actual complications. So we were talking about risk factors. Now we're going to talk about complications. This is one of the major things we learn about in medical school when we're studying a field such as diabetes or foot and ankle medicine, podiatry medicine, because we deal with so many diabetics. And the triad, as they call that, of complications is nephropathy, neuropathy, and retinopathy. And so for those of you that are thinking, what is she talking about? All this medical terminology. Okay, retinopathy is your eyes, your retina. Diabetes can cause blindness. That's what the retinopathy is. Causes damage to your retina, and that ends up causing blindness. Number two, the nephropathy. Nephropathy relates to kidney disease. So that's when people end up getting on dialysis and having kidney disease, renal disease. That is related to the nephropathy. And the neuropathy is the numbness that the diabetics feel in their feet, sometimes in their hands, but mostly in their feet. And that's what ends up causing infections and amputations and gangrene in the foot and the leg. And so a lot of people, when they get diagnosed with diabetes or when they hear about other family members having diabetes, the first thing they think of is, having an amputation. Because these three things are the three major complications of diabetes that a lot of people know about and a lot of people are scared about. So when we're talking about amputations, that is something that I've had to do as a surgeon. I've had to amputate people's toes. I've had to amputate people's feet. I've had to amputate half of a person's foot on more than one occasion. And I've had to send a patient to an orthopedic doctor to have their entire leg amputated, because as a podiatrist, I can't amputate up past a certain point. So if it's going to go up to the knee or higher, I have to send that to the orthopedic surgeon. This is not my favorite part of the job, obviously. And a lot of people ask me, how can you do that? How can you amputate someone's foot? Don't you feel bad? And what I have to tell them is when it's gotten to that stage, if it's gotten that far and that advanced in their disease, and their foot or their toe needs to be amputated, I'm actually saving their life. Because if we don't do that amputation, that infection and that gangrene is going to spread, and they could actually die from that. They could become septic and they could die. So if it gets to the point where someone is told they need an amputation of a toe or half of their foot or their foot, that doctor is trying to save their life. And that's something that I've had to deal with. And it's, like I said, it's not the fun part of the job. And it's one of the main reasons why I've gone into the health coaching aspect of my job, is because I don't want to amputate any more feet. I don't want to amputate any more toes. I will if it means I'm going to save your life, but that's not what I would rather spend my time doing. I would rather spend my time educating my patients and educating people about diabetes and what we can do to prevent it. If you're in one of those risk factor categories, but you haven't developed it yet, let's prevent you from getting it. And let me show you how, if you need help with that. And if you've already been diagnosed with it, or you've been diagnosed with prediabetes, let's reverse that, because it is reversible. There's been tons of studies done on reversing the effects of diabetes, and there's been tons of people that have reported that they no longer have to take medication, that they've reversed it. And as long as they keep doing these things, A, B, and C, they don't have to take medication. They still check their sugar and make sure and see their doctor on a regular basis to make sure that everything's going smoothly and that they don't have to take the medication. But, and so they do have to be checked, It's something that will always be a part of their life in terms of, monitoring things. but they can reverse it. And so that is what I choose to spend my time doing now with my patients and my health coaching clients. So let's get away from the amputations and get back to getting healthy again. But for the rest of this show, I just want to be complete and finish talking about these complications. So in terms of the amputations, more than 60% of amputations of the lower limb in the United States are performed because of diabetes. So the other amputations could be caused by trauma. Someone has a high risk job and they get a foot cut off in a machine, or a car accident, or in terror attacks. There's in military and stuff like that. There's obviously those types of amputations, but in terms of amputations that are not caused by trauma, more than 60% are caused by diabetes. The other 30-something% are usually caused by poor circulation and different things like that. So nearly 82,000 amputations are performed every year in the United States on diabetics. 82,000 lower limb amputations every year because of diabetes. And once someone has an amputation of their leg, their life expectancy goes down dramatically. It's very significant. So we do not want to be amputating people's legs and their feet. Okay. A little bit about the kidney disease. Among the U.S. adults aged 20 years or older with diabetes, the estimated prevalence of chronic kidney disease, stage 1 to 4, was 36.5%. 36.5% of the adults with diabetes also have kidney disease. That's a really high number. Among those with diabetes and moderate to severe kidney disease, stage 3 or 4, 19% were aware of their kidney disease. So what that means is, with the diabetics that have very advanced kidney disease, stage 3 and 4, only 19% of them knew that they had kidney disease. The other 81% of them didn't even know they had kidney disease, and they were in stage 3 or 4. And once they get, to 4, we're talking about dialysis, which is another severe thing that we don't want to get into, just like the amputations. Approximately 53,000 people develop end-stage renal disease with diabetes as the primary cause each year. And that's where we get into the dialysis. End-stage renal disease. After you get past stage 4, you're end-stage renal disease, and that's where we talk about having to go to dialysis 3 times a week. Okay. Preventing diabetic complications. As a podiatric physician, a doctor focusing on the treatment of diabetic foot and ankle conditions, we play an integral role in a diabetic management team. Diabetes can affect many parts of the body and can lead to serious complications such as blindness, kidney disease, and lower leg amputations. Working together, people with diabetes and their healthcare providers, such as a podiatrist, as I am, we can reduce the occurrence of these and other diabetic complications. Comprehensive foot care programs can reduce amputation rates by 45 to 85%. And what that means is, if you have diabetes, you need to be seeing a foot doctor regularly. If you're a senior, you should be seeing the foot doctor every 2 months, getting your nails cut, having your corns and calluses checked. Any other foot conditions that you have need to be checked by your podiatrist every 2 months. If you're not a senior, but you are a diabetic, you should still be seeing a podiatrist at least twice a year to have everything looked at. And that means if you don't have any problems with your feet, so you're not in pain, you don't have any swelling, you don't have any redness, you don't have any sores or calluses or anything that are causing you problems. If your feet look perfect, but you have diabetes, you should at least be seeing a foot doctor twice a year. Research in the United States and abroad has found that lifestyle changes can prevent or delay the onset of type 2 diabetes among high-risk adults. Lifestyle interventions include diet and moderately intense physical activity such as walking for 2.5 hours each week. And that's what I was talking about earlier in terms of getting our 20 minutes of exercise every day. My clinical experience. As you may know by now, I've been practicing medicine for over 20 years, and in that time, I've seen thousands of diabetic patients. My practice is specialized to focus on diabetic care and to prevent diabetic limb loss and amputations. I've discovered that most of my patients are not educated much about how to prevent complications of diabetes or how to reverse diabetes by their primary care physicians. I spend much of my time educating my patients about diabetes, what they should and should not be eating, and it's not just about the table sugar, how they can start to lose the stubborn weight and bloated belly by making a few simple changes in their daily routines, and how to save their eyes, kidneys, and feet from the damage that diabetes can do. My passion is to help pre-diabetics, borderline diabetics, women who've been diagnosed with prenatal diabetes, as research has found this to be a precursor to type 2 diabetes, and people who have been diagnosed with metabolic syndrome or insulin resistance to reverse their diagnosis and prevent full-blown type 2 diabetes from taking over their lives. If you have any of these conditions or type 2 diabetes and would like to discuss how we can work together to prevent or reverse diabetes, schedule a free consultation with me so we can dive deeper to find out what's going on and come up with an action plan for you. And if you want to schedule a call with me, I'll make it really easy. The link is drmichele.com/schedule. So drmichele.com/schedule. And I will put a link in the show notes, so it'll be really easy to click on that if you get a chance to look at the show notes. So I know I talked for a long time, 31 minutes, and I just really want to say that the diagnosis of diabetes is not a life sentence. We can reverse this. And if you're someone that is concerned that you might have diabetes or you might be heading that way, but you haven't been diagnosed yet, you're in the perfect spot to prevent it and to reverse the stages of the disease from taking over your life. So schedule a call with me and let's talk about it. All right. Talk to you soon. Today's show was brought to you by my coaching program, Beating Diabetes, the 10-week roadmap. For more information, head on over to my website, drmichele.com, and click on the Work With Me tab. All of the information is there about my group programs as well as one-on-one coaching. If you have questions about diabetes that you would like me to answer on air, you can email them to me. Just go to my website, drmichele.com/contact, to email your questions. And if you have questions you'd like to discuss with me over the phone, sign up for a free 20-minute coaching call at drmichele.com/schedule.